Hello, Lisa Broyles here with Way to Health MD, and this is my fourth video in the installment about the book Complete Bone and Joint Health Plan. This is going to be a controversial video because there's a lot of topics in here that people have argued about, and there's differing literature, and this one is about calcium absorption in our food. So first of all, you need to know that there's several factors that affect whether or not you can actually absorb the calcium that is in your food and your supplements, and these are the pH of your stomach, your vitamin D level, what form that calcium is coming in, and the transit time, how long it takes the food to travel through the stomach and intestine before it's eliminated. The last thing is what you eat. So first, let's address pH. For those of you that have had heartburn, gastric reflux, you are on a medication called a proton pump inhibitor like Protonix, Prilosec, Nexium. Unfortunately, the job of these drugs is to prevent your stomach from being too acidic. Well, this is a problem because if your stomach is not acidic, then you cannot ionize your calcium to make it absorbable. So you basically can't absorb any of the calcium from your food if you are on one of those medications. Now, I will say as a caveat to that, if you have Barrett's esophagus, esophageal cancer, or heartburn that you cannot get off of those medications, then you should try to take calcium-rich supplement or calcium-rich foods as far away from that medication as possible so that you can get some absorption so that when your stomach acidity goes down. So the lower the pH, the more acidic that stomach, the better you're going to absorb your calcium. So how high your vitamin D level is critical because vitamin D tells your gut whether or not to absorb its calcium. So if you don't have a good vitamin D level, then when you eat that calcium, the signal is not turned on to absorb it through the intestine into the bloodstream. So you need a vitamin D level ideally between 60 and 80 when your doctor checks your vitamin D3, which is cholecalciferol. Next, the transit time. So how fast the food moves through the gut. So many people now are on the GLP medications, that's your tirzepatide, your semaglutide, and these do help people lose weight, but one of the issues with these medicines is that they slow gastric emptying, which makes you feel full and less hungry. We've talked about that in other videos. How does this affect calcium? Well, the good news is for people that are on a GLP inhibitor, a GLP agonist, when you slow that transit time, you actually improve calcium absorption, which is really important because we're finding out that these medications are causing increased bone density loss, and that's because people are relying on the medication to lose weight and they're not lifting weights, which stimulates your bones to build. So if you are on those medications and you are lifting weights at least 3 days a week for 20 to 30 minutes, then you're going to maintain that bone density, and especially if you're taking the right form of calcium. So I talked to my patients about this, but calcium carbonate is the cheapest and most common calcium supplement, calcium additive that you'll see on the market. It is made from ground oyster shell. It is absorbable, but not as absorbable as some other forms. So calcium carbonate and calcium citrate, they both absorb at the same rate if the pH in your stomach sucks, which means you basically don't get hardly any absorption. But if you've got a healthy pH in your stomach, taking it with food improves the absorption of calcium carbonate. So if you're taking a calcium supplement, it's generally better to take it with food. Calcium citrate, it absorbs about the same whether it's with or without food. My preference for calcium in a supplement is calcium hydroxyapatite. I will talk about that in my later video about supplements for bone health, but suffice it to say that calcium hydroxyapatite is what your bones are made from. So last I want to talk about what you're eating your food with. We've already talked about what not to eat it with, your soda, your sugar, your fats, too much salt. There's some controversy about oxalates, and you may have heard about calcium oxalate stones, or if you've had kidney stones, typically they're made of calcium and oxalate. Now, kidney stones form when too much calcium gets into the urine and too much oxalate separately, and they combine in the urine to form a calcium oxalate stone. So this is where you need to know about foods, specifically vegetables that are rich in oxalates and calcium. We're going to talk about spinach, for example. So spinach is high in calcium, and it's really bioavailable good calcium, but it's also one of the highest vegetables in oxalates. So what happens is the spinach calcium and oxalates bind in the gut and do not absorb into the bloodstream, nor do they form kidney stones. Unfortunately, eating spinach will not improve your calcium levels because only about 5% can absorb because of all the oxalates in the spinach. This is true of Swiss chard as well. So you want to look for vegetables that are high in calcium and low in oxalates if you're trying to increase your calcium absorption from your leafy green vegetables. So this includes broccoli, kale, and bok choy. So these are wonderful vegetables that are rich in calcium but low in oxalates, therefore you can absorb the calcium in them. And that brings us to the last point, which is calcium in dairy versus calcium in leafy greens. So if your doctor has told you you have osteoporosis, you need to eat a lot of dairy products, but then your functional medicine doctor told you that dairy causes inflammation, what do you do? So my patients ask me this all the time. So if dairy for you causes stomach upset, inflammation, there's a gut reason or a chronic inflammation reason why you can't have dairy, there is bioavailable dairy. Actually, you can absorb 60 to 70% of the calcium in leafy greens versus only about 30% of the absorption of calcium from milk. So the truth is that leafy greens actually have a more bioavailable form of calcium than dairy, but it's also true that it takes a lot more of the leafy greens to equal the amount of calcium in a portion of, say, dairy milk. So a glass of milk has technically more calcium, but only 30% roughly absorption. And the skim lower fat milks have slightly more calcium than the full fat, but it's pretty negligible. So you would have to eat 6 cups, for example, of kale to equal the amount of calcium in your 1 cup of milk. However, your absorption is going to be about equivalent because there's less calcium in each bite of kale, but you're absorbing more of it. So more bioavailability, less total levels in leafy greens. So I encourage you, if you can eat dairy, to eat both dairy and leafy greens. And also, just a little tidbit, cheese has more calcium because it's more concentrated than yogurt, for example. So you're going to get a higher absorption of calcium from eating a cheese plate than you will from a cup of yogurt. So I hope that's answered your questions on bioavailability in your foods, and please email me with any other questions that you have. Thank you so much.